All right, Dr. Flores, thank you so much for your time. Can we start with you telling us a little bit about how you ended up at UT and what keeps you here? What do you like about our institution?
Sure. So I did my residency in Connecticut and I had the opportunity to go to UConn or choose between UConn, which actually was about 15 minutes where I was living at the time, and moving to Houston. And I'm originally from Texas, so it was a natural transition to move back home and come to Houston. And then, a couple reasons I stayed in Houston is one, it's a metropolitan city. It's the fourth largest city in the United States. And so there's a lot of opportunity for growth in the medical center, especially being in the largest medical center in the world. So, I mean, it was kind of a natural fit, even though I came from a small community center where I was a hospitalist. It felt very natural, and it felt like this was probably the place I should have been in the first place.
And then I know that you're a geriatrician. I'd love to hear more about your clinical work and how you interact with the residents.
So my one of my primary roles is on our ACE unit, which is acute care for elder, and it's a really unique opportunity for residents to rotate there because there aren't very many nationwide. And what makes it so unique is that the ACE unit has geriatric trained nurses and, of course, the geriatricians that help kind of supplement the care that we've already been trained to do as internists. And so the nurses really do a really great job about getting patients out of bed, calling physical therapy, making sure that those ancillary services or the other people that are on our interdisciplinary team see the patient right away so that we can get the patient out of the hospital as soon as possible. And so the residents rotate there and they get to see kind of the social issues. They get to see the transitions of care either to a nursing home or to home, and how do we get those skills to transition the patients from hospital to back home or to their next level of care in a more smooth transition. So it's a really great opportunity for our residents. And so that's where I kind of interact with the residents the most.
And how would you describe a UT resident? One of the hardest things for an applicant is trying to figure out if they're going to fit in here. So I'd love to hear a little bit about, what you like about our residents.
It's amazing what talent we have here in our residency program. In fact, I was just reading the newsletter that came out yesterday. We have arts and medicine, and so the residents also get to explore is it their left brain or their right brain, the artsy part of their brain. And one of the residents painted something, and I was like, wow, this is amazing. Like, it looks like a professional artist drew it, and there's so much talent. And the residents, it's a really open education academic center. I'm always learning things from the residents. And so, medicine changes so quickly, technology changes so quickly. When I was a resident, we didn't even have NOAGs. And so learning about NOAGs, all of a sudden, I'm like, when it first came in, the residents were like, oh, these NOAGs. And I'm like, okay, let me go read on the NOAGs. And so, it's a very open learning. Everyone's working together for the best of the patient. And so I like that. It's a very warm, welcoming learning environment.
And then let's talk a little bit about your division of geriatrics. What kind of opportunities are there from a scholarly perspective and maybe other clinical opportunities that are available to the residents and fellows?
So we're the division of geriatrics and palliative medicine, and there's a lot of overlap between both disciplines. Our division has quite a few faculty that do a lot of scholarly projects with research, including polypharmacy, osteoporosis, sexual health. We have one of our faculty members that does a lot of stuff with epidemiology and cardiology and elder mistreatment or elder abuse, financial exploitation. And so we have so many avenues. And so we welcome residents with open arms to come because we have so many opportunities. We just don't have enough people that are willing to help us out. So, there is a resident, we have a lot of scholarly opportunities to help beef up CVs if these residents are interested in going into fellowship too.
That's amazing. And then let's see, why don't you tell me a little bit about what you do like to do outside of the hospital? It sounds like you're a Houston transplant, and it can make people nervous to imagine coming to a city they've never been to. So, what have you found that you like to do in Houston, if you're comfortable telling us, or any
Sure.
hobbies that you enjoy around here?
Yeah, so when I moved to Houston, I wasn't married, so I met my husband here, and he's a Houstonian, and so it's just Houston has so much to do. So I'm going to say like kind of pre-kids, pre-family. There's a lot of places to go out. Great food. There's museums if you're into museums, science, art. There are parks everywhere. I think there's over 50 miles of bike trails that you can get onto. So I used to bike and run and there's a lot of breweries, there's even wineries nearby. And so, whatever you're interested in, you can find it. And I did find it here in Houston. So, that's one of the other reasons I stayed. Now, with kids in a family, I take advantage of the Children's Museum and the Science Museum. There's also a health museum. And now there's plenty of parks for kids to play at, and there's actually different parks for different ages. So if your kids are really small, there's parks that are catered towards toddlers, and as they get bigger or kind of in the mid 7 to 10 range, there's also kind of an adjoining park area where you can have both kids of all ages. And so, despite having kids, there's still so much, not despite having kids, but like there are just so much things that you can do pre-kids, post-kids, with kids. So lots of things to do outside of work.
Well, thank you so much. Are there any other questions that I haven't asked, or anything else that you think applicants should know about our program or our city as they try to make their decision?
Um, it's, it is a large place, but I don't think that you feel like you get lost here. We have a really good support system. There's mentors everywhere. You're set up with a mentor right away. And you can find somebody who's has similar interests that you do. You just kind of have to ask. Recently I started doing narrative medicine and working with humanities, and then I found out we sent out a survey, and there's like over 75 people that filled out the survey that are interested in narrative medicine, and I didn't even know that we're within the university. So I think if you're interested in something, we can find somebody else that's also interested in that too. So the opportunity to explore what you're really interested in is here within the university. And if it's not here, it doesn't exist.
It's so true. Dr. Flores, I just remembered one other question I wanted to ask you about, which is, you've done some really interesting work in sexual health, especially among older adults. Would you mind talking a little bit about that? Because I know that it's an interest of many applicants also, and it's a passion of yours.
Sure. So, I had a friend ask me if I talked to my patients about sexual health, and I said, why would I ask them? I have congestive heart failure, pneumonia, diabetes, everything to talk to them about. I don't have time to talk about sexual health. And then, with her question, I just kind of went and looked in the literature and did a PubMed search, and there's not a lot of publications, at least not with medical doctors, that have to do with sexual health. And it's really unfortunate because there's so many studies that support that doctors don't bring it up, and then patients don't bring it up, and the discomfort around that. So I actually was able to, with the support of the university, again, exploring the things that I'm passionate about. I got the support from our department to do two sexual health certificate programs, one in Michigan and then one at the European School of Sexual Medicine. And so I have an interest in training in sexual counseling and sexual health education, or sexual health educator. And so I kind of focus on not only sexual health for older adults, but also sexual health in general and the LGBTQIA community.
And are you able to teach our residents about that, or is that something mostly for patient care?
No, I teach the residents. I have done a couple grand rounds for transgender and LGBTQIA. And I'm also exploring a narrative medicine with transgender, gender identity, and intersex for our medical students as an elective coming up this fall and in the spring. So we also have exploring sexual health or sexual pleasure the week of Valentine's. So I'm really excited about that. And that's coming in the spring as well for medical students. So lots of opportunity to kind of share sexual health education so that our medical students and residents are comfortable talking about sex because it's such an important quality of life measure.
That's amazing. I know we're all so grateful to you for teaching on such an important topic. So thanks for your time.
Thank you so much.